You're listening to another episode of All the Bees with me, Dr. G, and my scrub tech, Bree. We're back for episode number 10 of our podcast. And today we're going to be talking about, it says SX, but kind of shit we would never do or surgery we would never do. Let's just keep it to surgery today, I think, right?
Right.
And there's a lot out there, but we're also going to catch up on current events. Correct?
But before we start our podcast, I would like to give a shout out to Dr. G's shirt. If we can show everyone the shirt, this is her labia shirt.
Yes, it is made by a boutique from LA called Grover Rad, and it's the Lady Leaves shirt, and it features artwork from 2008 Jonathan Yo's Falling Leaves series, where he took cut up images of female genitalia and made them into innocuous leaves.
Is there a close-up on this? If not, amazing. I have one, but...
Yes, you have to look carefully. It's very subtly and tastefully done.
Yes.
But since I do a ton of labiaplasties, I had to have this shirt.
Yes.
So
actual labias into the shirt. I hope she wears this to Thanksgiving, but...
I'm definitely wearing it to the next conference I attend. That's for sure.
Amazing. Absolutely amazing. The coochie shirt.
It's giving fall, y'all. Subversively.
Nothing fall like a cut up coochie.
Okay. Anyway, so yeah, let's talk about some current events. There's a New York Post article about getting their second BBL.
Amen.
After the first one died. I don't know what that means. After
died like she just lost most of her fat. That's what I assume she means.
Yes, I would assume that that's what she means too. So if your fat truly all died, it would be kind of bad, because if too much of your fat dies, we call that fat necrosis, and you would have like very hard areas of fat. So
it'd look crazy, right?
Yeah, it wouldn't look good. So I think died is a little extreme. It just means that she didn't hold on to it. And, people do say it's inherently dangerous. I would say every surgery elective is inherently dangerous, which is why you should do your research before having a procedure and make sure your surgeon is accredited and knows what they're doing.
It's a little more dangerous, though, when you put fat into the muscle, correct?
Yeah. So when BBLs first became popular, probably about 10 years ago, the Aesthetic Society had a task force and multiple studies were done, and they looked. And at that point in time, people were injecting fat into every layer, into the buttock muscle and into the subcutaneous tissue. And injecting into the muscle is high risk because you have the risk of entering one of the big gluteal veins or arteries. And so if fat goes there, you can get a fat embolism, and that usually results in death. So that is something we avoid.
Yes.
It's been such a problem in Florida that they've mandated both a limit to how many BBLs you can do a day, which is also
interesting.
Wild. I think it's 4. Wow. I don't know. I'm never doing 4 BBLs in a day.
No.
Those are what we commonly refer to as chop chops, because they're just... It's like a surgery mill for patients. So you're meeting the surgeon the morning of, you're getting marked, you're going to sleep. Maybe somebody else harvests the fat. They come in and put the fat in, then they leave, and somebody else is maybe closing the incisions and recovering you. So then the surgeon is hopping from room to room doing multiple procedures, and that's
crazy.
Yeah, it's risky. So why do people go? Because it's cheap. Then you're worried about, is a facility accredited? You run the risk of getting infection and sepsis, which are also not great. We have an image of this young lady with all her drains.
For just a BBL?
Yeah, that's not adding up.
Why would you put drains in a BBL? Don't quite understand that. I had my first one, I feel like I lost quite a bit of fat, but I had a really good shape. I knew that I needed just a little bit more to complete it. I probably lost about 40% of the fat that I had put in. But by the time I did the second one, it was perfect. And you always lose a little bit of fat doing that procedure.
Yeah, we overgraft because we know not all of it is going to survive. But I
Right.
don't know what she needs all those drains for. There are some people who put drains in after liposuction. I don't think it adds anything
Oh,
and can add, again, complications like infection. So
right.
yeah, a little wild. That, again, it just raises a whole controversy. Is like doing this stuff worth it or not worth it? I mean, she lost 125 pounds, 150 pounds. So that is, she's showing off all her extra skin, because that's what happens when you lose a lot of weight, what we call massive weight loss. You will have extra loose skin. And really the only way to address that is with surgery. So
Right.
and then there's Adriana Lima slams plastic surgery accusations.
I love her. I really do. She obviously just had a baby. She looks amazing, but her weight has gone down. Like her face does not match her frame. Like it is, I know she says she hasn't had anything, but it looks so overdone with filler, cheek filler, under eye filler, filler everywhere.
She has no contours. Like
Yeah.
she's a perfectly full face.
But I don't think that's the face of a tired mom. I think that's a face of an overfilled.
Right. They tried to fill in
Just
all
too
the
much. Every
little
crevice.
spots.
Not a fan.
No, and you just get people who are afraid of looking like that when, that is probably like 15 syringes of filler anyway. So no one in their right mind can afford that anyway. So when patients come in and they're like, "Oh, I'm so worried about looking like that," I was like, "No, because that's so much filler."
Yeah. You have to sell a small child for that. Give your firstborn for a full face.
Of filler. Yeah, at $800 to $1,000 a pop, no one's putting $10,000 worth of filler in their face unless you're a celebrity. So
Right.
one syringe of filler is 1 cc, right? So how many cc's are in a teaspoon? 5. So, even if you put 5 syringes of filler in your face, you're adding 1 teaspoon, but nobody does that. Maybe 1 or 2 syringes. So, okay, so let's move on. I feel like we've talked about SZA before. I would like to preface by saying I like her music.
We love SZA.
Why she keeps coming up in the Daily Mail and is always so stupid for getting plastic surgery. Like, I mean, did you get everything possible and then decide they were because haven't we talked about her breast implants before?
I think she's regretted pretty much everything she's had done, but she looks amazing.
So now she's regretting her BBL specifically. It was just so stupid.
Is there a reversal for a BBL? Can you like lipo that out? Is that a thing?
You can. It's not
I don't know why
ideal.
you'd want to, but
well, so we don't normally lipo the buttocks, so you really would only be doing this for a BBL, because if you lipo that area, you're at a pretty high risk of having sagging. So you're deflating what's now been stretched out. So there is no great way to do that. I guess if it's overinflated, you can slowly liposuction that down, but it's going to be a problem because you're going to have this stretched out skin with nothing to replace it. It's not ideal. I took really old buttock implants out of somebody once, and it was because they were infected and placed in Mexico. But yeah, it was a mess because she had these huge dents where the implants had been. It was wild.
Oh, I've seen some of those when they flip over, and it's really gross.
Yeah. Speaking of things that we do not ever want to do, you could add
butt
gluteal implants. Mm-hmm. You can do. I do think that adding fat is a good idea. There are some cartoonish women on Instagram with just huge butts that have overfilled their buttocks. And when that doesn't trend anymore, it's going to be impossible to reverse. So yeah, I don't know what her gripe is. Like, she has surgery regret, I guess.
She just needs to be, she looks amazing. She just needs to be confident, surgery or no surgery. It's already done. She looks great.
Yeah, I mean, she looks great. She's on the cover of Vogue, so.
Right. Like, her butt looks amazing.
Her
waist looks small.
Yeah.
Yeah. She looks so good. It's fine.
I mean, I think her issue is that it's really hard to be a public figure, and especially a woman, when you are constantly scrutinized for your looks, right? So
Right.
I don't know.
Just own
You
it.
talk yourself into doing things that you're doing not for yourself, but for your public image, or for somebody tells you, you know, you need to do it for your career or whatever. And then maybe that's not the right motivation for you.
Right.
So,
I feel like it'd be a little bit different if maybe she got botched, but I mean,
yeah,
she
she's
looks
had
great.
totally fine surgery.
Yeah. Come on, SZA.
Go talk to Doja Cat and move
Yeah.
on, because she loves her plastic surgery.
Yeah,
And she's essentially had the same things.
exactly.
All right. Let's talk about
Sharon
oh
Osbourne.
no.
I haven't seen her in the tabloids and oh wow, I have not seen this side of Sharon. Sharon got a facelift.
Yes. I don't know.
Fox+eye+lift, lips done. She looks
Yes.
amazing though.
She looks better. Her first facelift was a little weird, I guess. And then she's had it redone. I don't know. She also looks a lot skinnier there. So it's really hard to compare anything to anything.
She looks like one of those, like
Oh,
in all kindness, one of those criminals that go and get their faces redone because she looks like an entirely different person. So they can't like identify you.
yeah. It doesn't look like her at all.
No.
I don't even know what's happening.
No.
She looks like a mob wife.
She does.
She's giving mob wife.
Goals.
But yeah, her face looks totally different.
Need to be able to pay for those 15 syringes of filler.
I have no words for that.
She looks totally
her face
different.
is like pulled totally back. And then some of it is aging. You know, your face is going to become more square, and it's not commonly done or talked about, but some people will have a rhinoplasty to address the aging nose. It's just usually not front of mind for patients, and they're already springing for the facelift, so they don't want to do a rhinoplasty at the same time. But your nose does start to get elongated and drooping at the tip and maybe wider. And so as that's happening, but you're pulling everything else back, in certain people, it can look a little different, which is, I think, part of what's going on with her. I don't know. She just looks nuts.
She's definitely different.
Yeah, her face is like a different shape. She also, again, has lost a lot of weight, and maintained it. But yeah, she looks like somebody else entirely.
Yeah.
So
I'm kind of for it though. I don't know why. It's a little drastic, but I kind of like it on her.
yeah, she just doesn't look like her, which would be hard. But
Exactly. The perfect criminal.
yeah, I mean, maybe she won't get recognized when she goes out and about, because she doesn't look like Sharon Osbourne. Then she opens her mouth, starts talking crazy, and we all know who
And they're
it
like,
is.
oh, perfect.
Oh,
It's
okay.
her.
Okay, so yes, and what do you mean by disastrous facelift? One that didn't meet your goals? Because disastrous facelift is a nerve injury in my book, or like wound healing problems or something.
It also looks like she had a brow lift.
Yes, I believe she did. So good for her. Okay, well, let's talk about worst trends in plastic surgery, because there are a handful. And then I say we kick off with the rib remodeling surgery, because I just don't understand how this is catching on.
Who needs ribs, floating ribs, when you could be skinny?
So I know Joe Hadid, and he's a board certified plastic surgeon in Beverly Hills, who I like and respect, but he has gotten on this train of doing the rib remodeling. So they say they're bringing in the floating ribs. What they mean is they're fracturing your lower ribs to narrow the waist. I mean, you get some of that effect anyway when you're doing liposuction to that area. So he's doing multiple things. He's liposuctioning, he's adding fat to the booty, and then on top of all that, where the bruising is, he's fracturing those ribs. And then the kicker is that that's not like...
So they just heal where they're fractured?
No, they do, but only if you stay in like a waist trainer for a couple of months. So that's the beginning of the process. And then you have to stay compliant so that your ribs heal in that new position. So you're going to have to wear some sort of corset the whole time, which is...
Sounds miserable. I was also looking at one where they make small incisions on each side of your spine and they just take out the bottom ribs. Ugh. Don't know how I feel about that.
Yeah, I believe that Cher had that surgery a long time ago and talked about it, but like decades ago. Yeah,
Oh,
so your rib cage does expand when you have kids, so you're a little bit maybe wider than after you had kids, but I feel like a lot of these women haven't had kids yet.
yeah.
They're going for these very, very extreme looks. Now, I've seen a few of Dr. Hadid's patients on his Instagram, and they look reasonable. But if you do a deep dive into rib remodeling in Mexico, those patients
Look
look,
insane. Their
yeah,
waist is like this big, and their hips are like this big.
yeah, they look like Betty Boop essentially in a cartoon fashion. It's crazy. So it just isn't it's such a terrible idea. So yeah, Viva Plastic Surgery Mexico was one of the options that showed these cartoon ladies because they're in waste. I just can't imagine that it's good for your organs at some point to have
Right.
everything squished. It's
Yeah, to be that small. I mean, I could definitely go with my ribs, being a little bit more.
narrow. I mean, sure, but not enough to have my ribs broken
Never.
and then stay in a
Absolutely not.
corset for 3 months. That seems extreme.
And incredibly painful.
So yeah, so there's definitely people who have talked about having it done. 90-day fiance admits she wants to do it, and she probably just doesn't have the funds.
I'll do it for you. Come
And
into exam room 3. Do a little
then
pop.
there is also a former nurse who wanted a tiny waist like Kim Kardashian, so also had 2 ribs removed.
Just stop.
Again, not every plastic surgeon is going to offer this to you, and I'm not really sure what the goal is to have a 20-inch waist,
Right.
and look kinda weird.
Right. It seems more dangerous than
I
not.
just don't know what the long-term effects are too. So first of all, a lot of these people haven't had kids yet, so they're gonna have kids and expand the rib cage, so then you're gonna have no options. And second of all, I'm not sure how that affects, like, those ribs are there for a reason, so I'm not really sure I would have them removed. I'm not
Right.
what the respiratory consequences are over time, and yeah. So to me, this type of plastic surgery, I know there's no line in the sand, but for me, it sort of borders on body modification and not plastic surgery. So
Yeah.
plastic surgery usually is enhancing your normal, and body modification is creating something completely different. So generally the extreme of body modifications like, embedding horns in your head or splitting your tongue, which plastic surgeons
Oh,
don't do, but there is like a really subset of, like, I don't know, on the dark web or whatever, that you can figure out how to get this stuff done.
yeah. Like tattoo artists, I've seen them. They just go in and slice your tongue. I'm like,
Mhm.
mm,
Yeah, so that's body modification. We're not enhancing your normal tongue. We're now making it look like a snake or,
don't
you know,
enhance my horns.
we're embedding horns. So this starts to lean. It's giving body modification, in my
It's getting
opinion.
body dysmorphia in my.
Yeah, that's also true. More. So
Yeah.
speaking of taking something that's normal and also changing it drastically is skull reshaping. So Dr. Epley is somebody I trained with actually in Indiana, and he was a little out there when I was there training, and hasn't changed. So he never learned the word no. So if you ask him to do it, he will do it. Honestly, if he thinks he can physically do it, he will do it. He had some Swedish person come visit him, and he converted her into essentially a Barbie doll at her bequest. And his thing now is skull reshaping. He's craniofacial trained, so he's familiar with the ins and outs, but he will change the shape of your skull if that is super important to you.
Now
Now I
that
know it.
should be left legitly to the criminals that need a new face. Like why? Why? Like
I guess
why?
some people are just very insecure about their back of their head being flat. And so that is something
Get a
that he
wig.
will offer. Well, they could just grow their hair out a little bit. I don't
Right.
know. Like,
I
uh,
don't know how I
you
feel about
know,
that.
people have the occipital bump on the back of their head and they don't like it. And so he will fix it for you.
I
But
don't
it's
like that.
not easy, and it requires an implant or him shaving down your skull. Yeah, that's what he's getting known for, is skull reshaping, a custom jaw, and clavicle reduction. He
Oh,
also does every kind of implant you can imagine. So if you want a tricep implant
please
or a
don't.
pec implant or any implant, you can have that, a custom shaped implant. That also seems wild.
I am like oddly obsessed with the people who have really pointy clavicles. I think I've told you this before. I don't know why. It's very like Angelina Jolie. It looks so good. But if you are not meant to have it, I don't think there is any point of implanting anything. I
Yeah.
just don't shave down your bones. Don't implant a skull. I don't know. Calves, abs.
Yeah, I just feel like, so you're putting it in a foreign body that is, the tricep implant, the pec implant. Like if you put it under the muscle, the calf implant is a classic example of something that just didn't go well. So if you have to put it under the muscle's impeded. So if your goal is to work that muscle, now you have this implant under it. If you don't put it under the muscle, it's really under just such a thin layer of skin and subcutaneous tissue that is fraught with problems, because it's this foreign body that could get infected and cause problems. And then also, how are you keeping it in place with movement in that area if you do move the underlying muscle? So they tend to move around a lot. And if you're putting a sculpted specific calf or tricep implant, I just don't know how it's going to stay in place.
Right. I mean, implants under the muscle are already enough, when we're working out. I can imagine calves, like that's,
Yeah.
that does not sound fun.
Those stop
Also,
catching on because the incision is right across the back of your calf and you can see it.
you would know.
Mhm.
The calf or the lengthening where they like cut your bone and add like
Limb
what is it?
lengthening.
Yeah. To make men taller.
That is popular in Southeast Asian countries. People go to Thailand for that. It's another surgery. I don't know that anyone does it in the US. And if they do, I don't know. They must be advertising on the down low. But yes, it's essentially breaking your tibia and fibula or tibia. And then if you slowly fracture the bone and then separate it, more bone will grow, just like as if you had a regular fracture from an accident. And so they just kind of crank it open little by little and bone fills in and you can be a couple inches taller.
It's okay to be a short king.
Yes, I know. Yeah. Could you imagine you could fix everything. You could be a short king that's balding and just travel all over the world to fix stuff.
Right. That's true. Be a whole
Go to
different
Turkey
person.
for your hair. Go to Thailand and get your legs lengthened. Then hit up Indiana to get your skull reshaped.
Right. Did we touch on this? A patient was telling me one of her girlfriends went to Turkey and told us about, I think we might have touched on this in a different podcast, that they do plastic surgery, but then they'll also make incisions elsewhere. And then you'll come home back to the States and be like, oh, I don't have a kidney or I don't have part of my liver. And then they realize they took it out during surgery.
Yes.
And that's that.
She did tell us that story, which we were unable to verify. But that would be horrible.
Just hearsay. But she said the black market plastic surgery organ stealing is insane.
Yeah, that was wild. Yeah, you come back and you're like, this incision doesn't match up with what I had done. Oh, right. Now I'm missing a kidney. That's terrible.
Like how? There's nothing you can do about it.
No, you're done. You have one less kidney. Like I
went in for a rhino, lost a kidney. Sorry. I hate when that happens.
But it was a good deal.
Mm-hmm.
Yeah.
Cash price.
Cash price. Oh my God.
Let's not remove ribs and reshape our skull.
Okay. Yeah. So Justin Jedica is the human Ken doll, who is the extreme version of putting implants in everywhere. And I guess our producer had met him in an elevator in Vegas once, which was he as frightening, I wonder, in person? Because, and he was just on the new Dr. Odyssey show, which I haven't watched. He seems quite tall there.
I hope you took pictures.
Oh,
That he looks, I'm all for plastic surgery, but he looks insane.
Yeah, I think he was on Botched and they turned him down. And now he got a cameo on Dr. Odyssey starring Josh Jackson. But yeah, he is.
What surgeries has he not had?
I know. That's actually what you would. Those are all like. I mean, the thing is, he has probably implants in his quads and stuff. But if you've ever been to a Cirque du Soleil show, if you're going to put that outfit on, they have implants in the
outfits.
In the costume. So you're already going to look like, crazy person in this Spider-Man costume. So just put the implants in just get a designed costume. And then when you take it off, you still have your normal body.
Right.
I don't know.
Bananas.
I can't. Yeah, he's had we're going to talk about this trend in a minute too, but he's had the overdone fox+eye+lift. He probably has lip implants. He definitely has cheek implants.
Cheek implants?
Yes. Before filler, that was the thing. So
probably that was a thing.
20 years ago. Now nobody does it. But yeah, it's these little custom cheek implants you can put in over your zygoma. But no one does it anymore. Because again, it's a foreign body that you have to deal with later. So if it gets infected, it's a problem. It's sort of like chin implants too. Most people will just put filler in at this point.
Right.
I have not had the pleasure of watching Dr. Odyssey yet. It looked intriguing, but I'm not sure. Also, I heard via the Facebook group I'm in that he's actually a nurse practitioner, which made me less interested.
Oh, really?
Yeah. I haven't verified that. But if he really is a nurse practitioner, but the show is called Dr. Odyssey, I'm already out. I'm already done.
Please hold.
Before we've started. Don't even get me started.
I have questions.
And then back to, this is another procedure that Dr. Epley does, but Dr. Leaf Rogers in Beverly Hills does as well, which is shoulder narrowing or clavicle reduction surgery. I will say that generally this is done for the transgender population, but some women choose to do this, and there's your pointy clavicles, Brie, that you want.
Not as pointed as I would like.
Cannot imagine, I guess, and I just can't imagine doing this. Period.
Right. And it doesn't seem like there's that much of a difference.
They're more narrow. I just think nobody wants their clavicle broken in general. It hurts. It takes forever to heal. Yeah. And if it doesn't heal properly, clavicle fractures are more common in little kids. And so their bone remodeling is, bar none. So they generally get through it and have no problems afterwards. But if you break your clavicle as an adult, and it doesn't heal properly, it can cause all kinds of problems.
Right.
Because it's controlling your shoulder movement.
My son just broke last year. He broke his clavicle in wrestling. That's right. And then now he's dislocating his shoulder all the time. I don't know if that's a thing.
Related.
He went to go high five a friend, dislocated his shoulder. Not funny. I'm not laughing if you're watching this, but it was the story. It was the high five. But it was painful. It was not a fun
No,
healing.
That is so. You do not want to mess with that area. It's going to change the ergonomics of how your shoulder girdle. Yeah. And I don't know how this is the game-changing gender confirmation procedure no one's talking about, because, if you have the money to do the shoulder narrowing, then great. But you have to there are so many other procedures on the list of converting from male to female or woman to male. So if you're going, it's usually male to female. And there's a ton of, you have to take hormones. You're going to do maybe an augmentation. Facial feminization is probably next on your list, of which you can do, again, forehead setback or reshaping, jaw narrowing, tracheal shaving. There's a ton, rhinoplasty to feminize your nose. There's a million things you would want to do to the neck up. So if you've accomplished all that and you still have the energy to have your shoulders narrowed, then great. And the money.
Yeah.
But I think no one's talking about it because it's just not that important to
I've never actively looked at somebody who I thought was transgender and looked at their clavicles.
And been like, God, their shoulder, they look like such a
Right.
perfect woman, but their
I'm like,
shoulders
they
are
got
really
a nice
wide.
butt. Yeah, they look perfect.
Right. Why do they have such a low body fat percentage? And then you're like, oh, it's a dude.
Yeah, exactly.
Yeah, unless they're literally on hormones, and they can be in the same boat with us and be fluffy. So yeah, so it is interesting, but I don't think it's that popular for lots of reasons. And then we did briefly have, this is interesting. I mean, Cher has had so much work done, bless her heart, but she now has this lower lip issue that is clearly a migrated lip implant, which is unfortunate. And I'm not really sure why someone isn't brave enough. See, she did have rib removal. It was on there. She has vehemently denied that, but I feel like it was definitely bounced around about 20 years ago. So Cher's had a ton of surgery, and it's interesting that this just randomly came up because my associate, Dr. Chow, had a patient come in who wanted some filler. And she recently had a facelift elsewhere, which was interesting. But anyway, so she came in and Dr. Chow treated her with some filler, I think to the cheeks and some Botox. And when she went to do her before and afters, which the patient was willing to share, she tried to edit out her lower face because the patient has what Cher has, which is a lip implant that has migrated below the lower lip. So back in the day, we would put in a Gore-Tex graft in the lower lip. So because filler wasn't as accessible, it was a article, so it was a collagen treatment, blah, blah, blah. It wasn't that great. So you would literally take like a Gore-Tex graft you would use in vascular surgery, and you would make an incision in the lower lip and run it through to the other side. By the time I got into training, the only thing we did with those was take them out. So we weren't really putting them in. Some people will put in like a strip of fascia, which is, like take a little strip of dermis or fascia from somewhere else and thread that through. As you can imagine, the Gore-Tex is not, isn't you. It's not going to integrate so you can feel it. It's just funny because nowadays we hold the lip filler to such a high standard. Like people don't want to feel their lip filler. They feel like they can feel it in there and it doesn't move with their lips. So the technology has changed so that the hyaluronic acid-based fillers are stretchy. And when the reps come in, they talk about how their filler is more stretchy and integrates more so you don't feel it. But honestly, before that, we were just shoving in a piece of Gore-Tex and saying, suck it up if you want big lips. Like that's what you're going to have, this thing in your lip. And so now it's totally migrated down. So that is exactly what had happened to the patient Dr. Chow took care of. I just was curious as to why when they did her facelift, they didn't just make an incision and try and get it out. I guess if you don't know what's in there, you can't guarantee that you're going to be able to take it out, or it might be really scarred in, or you might create some damage, which is perhaps why Cher hasn't had it removed, or maybe she just doesn't even care. But 100% that is a implant that's migrated. And it's interesting to me because I hadn't thought about it for a while. And then we had this patient that came in that clearly had it. And then I think I was in the OR and my sister texted me a picture of Cher's face and was like, what is going on here? And I was like, oh, funny you should ask.
Yeah, twice in 1 week. Yeah,
Yes.
I'm very curious why they do not get these removed. I understand, like you said, it may be difficult not knowing what's in there, but your face is just what everyone sees, and they look crazy, not natural.
Yeah, I think it's worse when they smile.
Yeah, and you do all this work, and then you have this migrated implant.
That being said, that picture of her to the left, aside from the lip implant, damn, like her face has not changed. Like she doesn't have, that squared lower jaw that comes with aging. Her cheeks are full, but they were always full. Her nose was done, but it still looks like her nose. She's always had big eyes because I have those same eyes. They look great. Like the rest of her looks just like her, but better, honestly.
Yeah.
So that's the one thing. Maybe she doesn't notice it as much. I don't know.
I feel like you'd have to.
I know. The thing is, you're going to feel it, right? You're going to feel it in your mouth. So
Yeah, like
It's
that
just
just
got to
looks
be
so
annoying.
unnatural.
Yeah, it does really offset the whole thing. Oh, well.
We tried to envision it as one time Dr. Gallus took out my birth control and the Nexplanon was implanted into my arm and it was so stuck.
It was embedded. It was ugly. I just insisted on taking it out through the teeny tiny incision that they put it in with.
Yes.
So I essentially had to prop my feet up against her arm and pull.
Literally, that's exactly. I have the video. If you can envision it, that's how it was done. Just her
'Cause I didn't want-
yanking it out.
Because it was so, yeah.
So
but
stuck.
I think you could go in through the mucosa on the inner, on the inside of our mouth, and then you could make a bigger incision. I just don't want to make a huge
Right.
incision on your arm to scrape that thing out.
Right.
We got it done.
We did get it done, and we have some great footage to account for it.
What could possibly go wrong?
Yeah.
I don't offer that to the general population. Just
Yes, please
FYI.
don't come in asking for birth control removal.
Okay, so let's go to the fox+eye+lift.
Fox+eye+lift.
We've had patients call about it.
Yes.
One snuck into my clinic asking for it. And I think she was in her 30s, and she'd already had an upper blepharoplasty and 2 brow lifts. And I said, nope.
How is this so different from PDO threads when people use PDO threads? I know they're not permanent.
I think it's not. It's just this is more permanent. Also, come on, you do have some makeup is your friend here. So
Right.
you can contour the hell out of your face. The angle, the first photo, she's 12 and before we had filters. And the other one,
Right.
she's completely done up and has filters on and
20
highly
years later.
stylized makeup. She looks amazing, but
I don't love it.
I don't doubt the facelift. I think we've talked about this before. She is probably had a facelift. She looks way too lifted. And then maybe they did a temporal brow lift. And then I don't know that she had the fox+eye+lift, but it definitely looks foxy. But when people, her eyes are always kind of so a couple of things when you look at people's faces, her eyes tilt upwards, the outer corners of her eyes tilt upwards, which is favorable. I know because mine don't.
I'm trying to look at mine in the camera.
I already know mine don't. I have more round eyes. And she has a very small aperture that tilts up. It's very favorable to start with. And her brows were in good position anyway. So yeah, I think if she had the fox+eye+lift, it generally involves tightening up the inner corner of your eye and then doing a temporal brow lift. But see, she's always had those little lids.
Yeah.
I think it's a lot of makeup and the way she's holding her face.
I feel like this is more of a trend for models who want that crazy runway. I don't know. I feel like they definitely achieve it with makeup. Not a huge fan of this trend.
She looks amazing. I think getting surgery to make it look like you have a fox eye is nuts.
Yeah.
Luckily, in that area of your face, it doesn't hold out great, even surgery, so it'll probably sag with time. The PDO threads are, if you really want to try it, are a great way to try it because they don't last that long, probably 6 months, maybe a year. But as the threads that are lifting up that area dissolve, you go back to kind of where you were. So it's, if you want to try it on and you're not committing to something permanent, that's reasonable. And then you can decide if that's something you like.
Right.
But somebody who's already had that done and then, or some semblance of a temporal brow lift, so your lateral eyebrows lifted, and then wants more, that's when you start wondering,
is there any
not the right move
chance of it impairing your vision? Is that a thing?
No, there should not be any risk to your vision. There is a risk to the temporal branch of your frontal nerve, or of your facial nerve rather. So there are some nerves that travel through there. So again, don't go, to the strip mall down the street to have this done because you can end up, if your nerve gets damaged, you can end up, not being able to raise your forehead on that side, not being able to close your eyelid properly, not being able to squint. There's definitely some issues if that nerve gets dinged. And most plastic surgeons and facial plastic surgeons who work in that area are quite aware of what the risks are. So when you do a brow lift, you have to know where the nerve travels and what layers so you stay out of that.
Side note, can we go back to that picture really quickly of Christina Aguilera? Are we seeing the square boobs? Not to segue from the fox+eye+lift.
Yeah.
Don't they look kind of cray-cray?
Yeah, they look a little nuts. They look like they're subglandular, which, I'm not a huge fan of. And yeah, put some fat in there. She has the money.
Yeah, she needs a little something.
Even if she doesn't have the fat, she could just put some fake fat in there, Renuva or whatever.
Yeah, she can afford the fake fat.
Mm-hmm. Just camouflage it a little bit because you're really looking at skin over implant there.
Yeah.
Mm.
Now that I'm done criticizing her boobs, we can move on to the Miami+thong+lift.
Ugh.
Don't know why this is a thing.
I can't believe this was on the ASPS website, but because when I was doing research into this, because I saw it pop up on my Instagram, and then I had a nightmare that I was marking somebody for it.
She did.
Mm-hmm.
She came in and she was like, I had a nightmare. I was just this little crevice in the butt. So can you explain the difference between getting a BBL and just a thong lift?
Yeah, so a BBL is not actually doing any excisional surgery or lifting anything. It's just filling your butt with fat in the areas that you wanted. And it will increase projection and maybe give it a more lifted look unless you overdo it, and then everything starts to sag and you get the so-called diaper butt. But the thong lift is excisional surgery that is basically a pattern of excision that follows a thong. So intergluteal crease excision of tissue, which I'm not really sure how that is going to lift anything. And I think it's one of those things, it's fetch for plastic surgery. Like,
is this a 360 thong lift? Or is it only on the backside?
It's only on the backside. So you're just, I don't know what you're lifting. You're just taking out skin from the medial buttocks. It seems dumb on so many levels.
I don't understand.
I mean, I'm sure it's safe-ish because you're just taking skin, but you're going to create a scar in the gluteal cleft. We know that area is going to be a little bit prone to having trouble healing based on where it is. It's so fetch. Don't make it happen. And so we know that area is usually the access for putting in gluteal implants, if anybody's still doing those. But it's prone to infection because it's in the crease of your buttock. I understand why someone's trying to do it, because typically a buttock lift would be an incision that's kind of where your waistband is, so where the top of the thong would be, and that's an incision kind of all the way across your back. But yeah, I mean, Constantino Mendieta, he's always trying to invent something, and good for him, but
I just feel like that wouldn't heal well.
He's always trying to invent something.
Let's uninvent this one.
Yeah, he needs to take this one away. He was one of the originators of BBL surgery, the actual fat grafting, and I've sat through many a lecture where he breaks down women's butts, which is truly alarming. But yeah, I don't think this is going to catch on. That's my 2 cents.
Don't do it.
Don't do it. If you really need a buttock lift, then you probably need the traditional, back lift surgery. There's nothing else. That's an established procedure. I think he's trying to do it without using an incision that's across the top. I don't know. But you're not moving in the direction that you need things to go up.
Right.
So it's
interesting.
Wild. Okay, so I guess we can start wrapping it up. We're going to add to our list of things I would never do anything that involves the penis.
Just don't. Please do not touch your penis. Do not insert. Do not take out. Do not poke. We need to leave the penises alone.
Again, fraught with problems. And for a while, we almost had to block a number. Somebody was calling our all-female office asking for penis enlargement surgery, correct?
Right. Yes. I don't know why. As a man also, if you're wanting penis surgery, go to a man's office.
I don't know. Yes, we're not offering that here.
No.
So you can do injections to increase the girth. You can do filler there. I know. First of all, men are kind of babies. I present to you man flu as Exhibit A.
It's been going around this week. Eric, I thought, was going to die. Literally. Could not even function. He's like groaning and moaning in bed.
Yeah. So I don't want to inject down there in somebody who can't even handle the common cold. So not him specifically, but in general.
No, it's true. No offense to all the men out there listening to this, but call it as we see it.
So yeah, so people will put filler in there. People will put fat in there. Again, now you're putting fat in an area that doesn't have fat, so that tends not to take super great, but
where
whatever.
are you injecting this?
In the shaft between the skin and the
superficially.
Uncomfortable. Mm-hmm. And then you can wrap an implant. I'm sure Dr. Epley's done it. I've actually taken them out. Again, I don't know why I keep referencing Beverly Hills, but there was somebody in Beverly Hills who made his mark putting in penis implants. And not the kind that give you an erection, the kind that wrap around your actual shaft and make it bigger. And we had somebody when I was in the Navy who had theirs get infected and it was eroding through the skin. And urology needed to take it out and called me, the only female plastic surgeon on staff, to help
lucky.
them. I know. They loved me.
I think I've seen more pictures of penises dying than not.
Yeah, it doesn't go well. There's not a lot of room for error there, honestly. And so, and it's, it's not a clean area. I don't know. I
just have to know the level, like the thought process behind wanting to do stuff to your penis. Like you really have to be, I don't
insecure.
know. Yeah, feeling a certain way. Not trying to call out any men, but I just want to know why.
Just get a fancy car.
Yeah, just get a big truck.
I understand, like, I guess, women who have no breasts type, and want a breast augmentation, that's, it's a little equivalent to that. It's just unfortunately not an area that is amenable to being made bigger easily.
Yeah.
It's sort of like being taller. Yes, you could go to Thailand and get your legs broken and extended, but that's not, it's way easier to just be short.
Right.
Whereas there's a lot of other plastic surgery procedures you can do that are kind of like relatively simpler fixes without the risk of having problems. Because if you have a complication in that area on your penis, it's not gonna go well. Like,
right.
It's not great. But yeah, the penis enhancement surgery is a little unnerving. And then there's things like scrotox, so Botoxing the scrotum. Mm-hmm.
Wait, why?
So
what benefit does that do?
I don't know. It makes it less wrinkly. There's scrotal tucks and then implants for the testicles. Which if you're
Botox
missing
the vagina?
No. No one's come up with that yet. It would just relax it. It doesn't make any sense.
So interesting.
Anyway, yeah, and then you can do implants in, like a testicular implant for somebody who's lost a testicle, that makes sense. But the same patient that I took care of that had the implant that was eroding through his penis had chin implants around his testicles to make his testicles larger, which again,
oh, that hurts my heart.
Why? But I guess if you're looking for that kind of surgery, at least go to someone who's accredited and don't go somewhere that's, going to leave you with an infected implant and a bigger problem than you already had.
Or someone that's going to just take the penis and black market it somewhere.
Take your kidney.
Yeah.
Okay. So that kind of wraps up our around the world of plastic surgery procedures we wouldn't do. I mean, there's plenty that we do. We don't need to do anything else.
We love plastic surgery.
Yeah. So thanks everybody for listening, and we'll be here to break down any trends you have questions about. So if you're interested in wondering why a certain surgery is out there and who's doing it, let me know, because usually when it's a niche surgery like that, they work really hard to get the press out there and make you feel like everyone's doing it when no one's doing it.
Right. Hit us with some questions.
Like and subscribe.
Just thinking of Juju. All the bees will be back.
If you're listening today and have questions, need info about scheduling, financing, reviews, or photos, check out the show notes for links. Restore SD Plastic Surgery is located in La Jolla, California. To learn more about us, go to restoresdplasticsurgery.com or follow us on Instagram at restoresdplasticsurgery. If you enjoyed this episode, please share it and subscribe to All the Bees on YouTube, Apple Podcasts, Spotify, or wherever you like to listen to podcasts.